Oh no, we are live. Oh, okay. Wait.
Do you all know who is viewing? Like, will you all
we
be able to
can
tell
see.
who's viewing, or
Yeah.
no? You can see who lah, not only the number but who is viewing as well.
No, we can't. Just the number of views. Okay. Hello, everyone. A very good morning, and welcome back to another episode of Alumni Rendezvous with today's topic of left-handed dentistry. My name is Nolan, and I'm your host today. And today I have my co-host with me.
Hi, I'm Dentistry. I'm the third-year dental student.
Okay, and today we have two very special guests. They are private practitioners and also alumni of Batch 9 of PIDC. Let's welcome Dr. Yi Xian and Dr. Doris Tan. Hello, Doctor. Thank you for joining us today.
Hi guys.
Hi.
Thank you for
Hello,
having
good
us.
morning.
Okay, Doctor. So today we're here for you to give us a first-hand look on left-handed dentistry, your challenges, your experiences, and everything. So to begin with, we know that practicing dentistry, it requires like a specific skill set, and also it involves like certain like coordinated movements with our arms, like maybe fingers, hands, and I'm sure both of yourselves have faced like certain difficulties throughout your life. So could you please like tell us what it's like being a left-handed dentist yourself?
Izian, you
Doris, you want to start first? Okay. All right. So maybe I start first. Yeah. So yeah. To be honest, I don't really know what is it like being left-handed, because I do not have any first-hand experience on how you guys as right-handers do. So to me, it's actually quite normal, because I started pre-clinicals back in year 1, already sitting on the right side, doing it with my left hand. So I can't really answer you how do I feel per se, but I do see some challenges that not only on my side. So talking about my surroundings, for example, my nurses, I think they are quite. They always complain to me, saying that they cannot see what's going on. When I always say suction, they say, I know you need suction, but I cannot see. So don't scold me. Don't show angry and whatever. It's because it's quite hard for them, which I totally agree, because can you imagine patient is sitting right in this side and my handpiece is over here. Nurses are always standing on the left side, so I'm actually blocking their view. So I find having a nurse that is also patient, even left-handed nurse can't handle left-handed dentists like myself, because it's just us blocking them throughout the whole procedure. I mean, Doris, do you agree with what I'm facing though?
I can imagine but because it didn't happen to me, because I work on the right side with the right hand, like usually how everyone else.
Okay, then maybe we get into that later. So
yeah.
So basically for me, the second part is the dental chair also. So the dental chair, I'm not sure if you guys know, the ones in PIDC is the one that you pull, right?
Yeah.
So you pull, you lock it, and then you can do. And the one in preclinical, if you remember, is those the one that is slotted in those preclinical room. I'm not sure if you guys still have that even in India, the preclinical that has all the handpieces and those slots that you have to pick up. I find those harder for left-hander people like me. I prefer the one in PIDC clinics that you pull and do, because when you pull, the wire stays on top. So it's not bothering, not on my patients, not on not blocking me, and that's where I get to do my work very easily. But when it's from the bottom where I have to pull, then the wire always tend to lean on my patients, which I don't really like. So The other challenge that I find is basically I feel that I'm a bit rude in a sense because I need to use my left hand cross over my patient's head to pick that handpiece, or sometimes suction has to go over my patient that it may land on their chest. So these are the things which is not too nice, and just trying to see what I can do to correct that. So all in all, I think my nurses, quite difficult for them to assist me. And number two is the type of chair is something which is important for me. I need those type that I can pull, and if luckily for me, I'm able to use that in my clinic now. So yes, what about you, Doris?
Well, my story is a bit different from you, I think. Yeah, so I am actually born a left-hander, so I usually use my left hand to write and to use chopstick. So, but I can use my right hand to use the knife and the scissors. Yeah. So,
Wow. Okay.
yeah. So actually, I like Zen, I started using my left hand to do my preclinical work. So I got so used to it, that I didn't think that's gonna cause a lot of trouble or what. So when come to our third year, I remember I was practicing my preclinical restorative or crown prep or something like that. So one of my lecturer came over. I think it was Dr. Ali, our HOD of cons at that time. Yeah, so he saw me using the left hand with the handpiece. So he actually told me, he say, you see, it's better if you try using your right hand with the handpiece because it might make things easier for you in the future. So
Not fair. Dr.
I
Ali didn't
actually
tell me that.
because he was my mentor. Yeah, so actually his advice got into me, so somehow I decided okay, I should try to use my right hand. So it was a bit struggle at first because when you grip your instrument or your handpiece, it's like gripping a pen, and I don't write with my right hand. So yeah, it was quite difficult at first, but after some practice, it became better. Yeah, so I've been using my right hand ever since.
Oh, so
Yeah.
doctor, like you said that
Amazing.
you use the knife, use the scissors on your right hand. Do you play
Yeah.
sports with your right hand as well?
No, 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 no. My left hand is still the
The
dominant one.
dominant one. All
Yes.
right.
Okay, so thank you, doctors, for sharing your experiences. So I'll pass it on to Basri.
Yeah. So before enrolling into dental school, did you expect any challenges being a left-hander? Like, did you expect that the setup will be
Honestly,
made for right-handed?
so to me, no, because prior to dental school, everything we do in college, in school, or in anything, even driving school, it didn't really occur to us or to me that being left-handed is something that I will face any problem. It's just normal anyways, seeing patients and stuff like that. So to me, I didn't, it didn't occur to me actually, even during my preclinical years and stuff, to me, I didn't find that it would be any issue, and I just go ahead onto it. So yeah, to me, I didn't expect that, being a clinician after graduating, when I have nurses and stuff, then I know that my nurses are actually cursing me when they're assisting me. Yeah. But before that, no.
What about you, Dr. Doris?
Yeah, same for me because previously during school and everything is like I've been using my left hand to write and
Normal.
everything. So yeah, like it feels normal.
Okay. Okay, thank you, doctors. So, doctors, I've also had like not complaints, but like my friends' experiences, my seniors' experience, saying that whenever they use like needle holder for suturing and procedures that usually involves like handpiece, like scaling, cavity, and crown preparations, and the main problem that they had were like angulating the instrument. So, like based on your experiences, have you had like any consequences when you're using your right hand? For example, like maybe musculoskeletal complications, maybe like less precision, or maybe it's time consuming for your procedures?
Doris, would you like to
maybe
comment about that first?
Okay. So, like I said, at first, when I'm not used to it and I just started practicing using my right hand, it was difficult. Yeah. So, but after practicing some time, gradually it became you became more used to it. Yeah. So currently, right now, it feels okay. Yeah.
Okay.
Yeah, for me, yes, actually. So I do know what your friend mean by suturing and stuff. So it's all about how I position myself then. So I still use left hand to do all my suturing and stuff. I do find it quite difficult. Even, the toes that we make, I'm still trying to figure out, if right-hander do the transit the same way, it doesn't stay. I don't
Yep.
know if any left-handers out there will agree with me. So I'm still trying how to. So I'm practicing for how long, and I'm still trying to find out how to get my suture to stay in there. Maybe it's just my fault. Maybe it's just my skill. I don't have this skill, but yeah, I find that it's quite hard. So not only about suturing, I even find restorative work, placing my handpiece to reach distal of the six, or those back areas, is quite hard to angulate if you're going in from the left, left side, sitting on the right-handed position. So these are the process. I think for me, restorative is one of the hardest aspect for me. So maybe that's also why I don't really like to do that work to begin with. So or rather, thankfully, I don't like to do that kind of work. So with me being a left-handed, so I don't really have to face that so much. I can always pass it on to my colleagues to get them to do it for me. As for the questions of any pain or discomfort, yes, I do.
Yeah.
So like I mentioned earlier, I always have to overstretch to pull my hand pieces. When I do this motion frequently, that's where I get a little bit of a sore towards my shoulder. So maybe it's time for me to retire. I don't know.
No.
That's
What
early.
about you, Dr. Doris?
Yeah. So yes.
So like I'm not sure if you guys still use hand scaler, but do you find it difficult to use hand scalers? Because I think it's designed for right-handers, is it?
So I
Actually,
do
I
use hand scalers quite a
think
lot. Sorry. Yeah, I do
Yep.
use hand scalers quite a lot, and we did have this. I did have this discussion with one of my colleagues. He did say that the 13 and 14 is supposed to be for the distal. Maybe you use it for the mesial instead, and then the 11 12 supposed to be for the mesial. Use it for the distal instead. We did try it, but somehow it didn't really work. So it's just how we then position ourselves, tilting our patient's head to actually suit me rather, so that we can actually use those curettes properly. So I still don't find, maybe I'm not doing it right, but I don't find, I still get to remove whatever I want to do using the same instruments. So I don't see the issues in that side.
Doctor, did it like affect your time management or anything like that when you're doing any
Sorry,
procedures?
I can't hear what you said.
Oh, sorry. Can you hear me now? Yeah. Did
Yes.
it affect your time management of doing these procedures? Maybe when during dental school?
Okay. During dental school, yes, I was very, very slow.
Okay.
Yeah, until some of my lecturers also tak boleh tahan, and they start saying, "Hey, Doris, you need to be faster." So I was like, "Oh, okay, okay." It was quite stressful at that time. Even when I first started my government service, um, yeah, because it's like more than 1 year we didn't practice anything. Then we went to work in the government
Mm.
sector. So when we first started on that patient, it was it was quite slow also. Then after eventually it became better. Yeah.
Oh, that's good.
So unfortunately, on my side, I'm still slow. I don't. I mean, now only I come to think of it. Is it because I'm a left-hander that's why I'm slow? Because I've always been slow, regardless college, government, or in my private practice now. I I have always been slow, but I've always thought it's because of me. So maybe now I can also put the blame on me being a left-hander. So yeah, that's why I'm a bit slow. I can tell my front desk, don't rush me, and so on and so forth. But yes, I am very slow in a sense, especially when I do, like I say, restorative work. I always allocate myself a longer appointment time. Like when they ask me how long do I need, I always put more than what maybe my colleague gives, because to me it's because I'm slow anyway, so that's why I thought I would give. But maybe it's because of this angulation, now that we are talking about it and now that we are discussing, because I do find it difficult reaching certain angles, and yeah, so I'm still slow even up to now. Sadly.
All right. So what are the ergonomic challenges that you face being a left-hander?
So
Then you
Doris,
want
maybe not,
to
because she's actually considered a right-handed already. So me as a left-hander, my ergonomics. So I think Dr. Lahari, Dr. Wamsi used to scold me a lot because I like to bend. I don't use indirect vision. But maybe it's my left-handed problem. So so yeah, I still do that. I still bend, even though I use loops, even though I have whatever, I still bend to actually reach, because when I do it with my left hand, sometimes my mirror is blocking. Yeah, so maybe that's one of the challenges. Suddenly I think about it. So maybe mirror is blocking, so I cannot actually put my handpiece and my mirror at the same area, because my mirror then will block how my handpiece will move. So I will not be able to use my mirror. Then I have to kind of go through looking through a direct vision, bending myself to be able to see what I'm going to do, knowing already the area is such a small space. So yes, so I do bend a lot, which is not good. So that's why I say I'm going to get all this back and shoulder ache. Sometimes I also get my patients to help me by lifting up or extend their head, so that it's a bit more perpendicular, so that it helps me in a sense. So but normally I'll just do it quick, then bring them back to the normal resting position, so that I can. Yeah. So it's just that I'll do as much as can, and that one particular spot that I cannot reach, that I need them to help me, then I'll just ask them to extend, and then I just go in, and then I come out. So yeah, so for me, yes, and I bend my wrist a lot. So I guess for you guys it's more on this motion, but I do a lot of this because so I overstretch basically. I do a lot of stretch too much. Yeah.
Okay.
Yourself,
So
Doris?
do you squeeze space with the assistant?
Do I what? Sorry, squeeze space?
Do you take up more of the space of the assistant, where they can't even sit down properly?
So lucky for me, the dental chair that I'm using, it has the spittoon is actually quite far. So there is quite a big space there. So yes, I do squeeze them, but they still have space. If I really can't, then we will switch. So I will move to my left, and then my nurse will go to the right. But then that's where the downside is, where the suction tubing would then have to cross over my patient's chest. I don't normally do that a lot. I only do that if I'm doing a longer procedure that I need to do on the left. Then I will ask my nurse to switch. If not, I will just, like you say, squeeze with her on the left and kind of get to what I want to do. Then I'll done. So I'll probably do the majority, maybe 80-90% on the right, as much as I can. Then the final bit, which I think I cannot do on my side, then I will go to the left to do. And honestly, it's very weird sitting on the left side to do dental procedure. So I find it very, very weird when I'm doing it in that side. So that's why I don't just sit onto the left to do it. Anyways, I only do it for a certain treatment. And yeah, because I find it very, very funny to sit at that side. That's why when you ask me, do I face any challenge? To me, I don't. I mean, to me, I don't even know that was a challenge, because that was very normal to me already. Yeah.
What about Dr. Doris?
Well, I think the ergonomic challenges that I face is pretty much the same as right-handers. Yeah, but I do sometimes go to the work from the left side of the patient. Like say when I need to do scaling on the fourth quadrant, yeah, or maybe sometimes MOS on the third quadrant. Yeah.
There you'll be using
But
your
when you
left
do
hand.
that, you use your, yeah, sorry, I was about to ask the
If a
same question.
handpiece, if it's a handpiece, I still use my right hand to hold the handpiece. But let's say if I need to use a couplet, some hand instrument on the third quadrant, yeah, I'll use my left hand. Yeah, like forceps, if I need to extract something on the third quadrant, I'll use my left hand. Yeah.
Okay, thank you, doctor. So move on to the next question. So throughout the years, have you tried, as a left-hander, have you tried ways in adapting to your right hand instead of your left hand? Like, was it a difficult phase for you to adapt to your right hand, being a left-hander in dental school?
Okay.
All right, so for me,
As
oh, sorry, Doris, yeah.
sorry. Yeah. So
I don't
yeah,
know why
in
it's a
dental
bit laggy.
school.
Okay.
So in dental school, yeah, initially it was a big struggle to use the handpiece, especially to do some precise work like restoration, yeah, and crown prep especially, yeah. So because you need to hold the handpiece or instrument like a pen,
Yeah.
which I don't use my right hand to write, yeah. So it's kind of it's a challenge, yeah. So I actually took a long time to get used to it. Yeah.
Okay. What about
So
you,
to
Dr.
me,
Yisian?
the only treatment I would say that I use my right hand is actually oral surgery department. So meaning to say, yeah, I give LA with my right hand. I do extraction with my right hand. And that's because I don't remember who, but it was a senior, a left-handed senior who told me that in oral surgery department is the only department that you have to use your right hand. And which I totally agree because the position we stand and extractions are all based on not really, I mean, maybe a bit of a strength, but it's all about the technique on how you want to use and how you're going to rotate and how you're going to remove the tooth, right? So if I were to use my left hand standing on the right side position, I can never do that motion as well. And in PIDC last time, the spittoon and the space is quite small, so I didn't have the chance to actually stand on the left side back in the uni. So I have trained myself. The only thing that I use my right hand is giving LA and doing extraction. So I use my luxators with my right hand. I use my forceps with my right hand, and that helped me quite a fair bit because really the position on the right side is more suitable if I use my right hand. So apart from that, yeah, nothing much effort that I'm actually doing to train my right hand. So the only thing I'm training myself to do is just the extraction. So I think because like for Doris, it's more on Dr. Ali telling her way in during her infancy stage of holding a handpiece that she should actually change it to the right hand, and that's where she did it, and she's so comfortable with it now. And if only someone would have told me then. Anyways, so someone told me to use my right hand to do extraction. So therefore, when I do my extraction now onwards, or rather than until now, it has always been right hand. Yeah. So that's the only
Thank you,
efforts I
doctor.
guess
Yeah.
I'm doing.
So I was reading like an article. They concluded that there is three types of left-handers. So there's the genuine left-hander, pseudo left-hander, and the transformed left-hander. So I believe Dr. Yisen is a pseudo left-hander and Dr. Doris is a transformed left-hander. Am I right?
Yeah,
Yeah.
actually,
Looks like it.
yes, you're
How did it
absolutely right.
happen?
Yeah, and I so for me, pseudo, I think like what I mentioned is I think it's both of us also have the same experience. Someone told us for me, it's as a left-handed that it will be a disadvantage if you use your left hand here in this department. Whereas for Doris's point of view, it's more on the lecture. But I also know someone, I think my junior, I think Guo Wei, I'm not sure if he's here, 11 batch, he is a transform as well. I thought he was the only one. To be honest, I thought all left-handers facing the same issue as me until, I call upon Doris to join this talk, and then we only realized that she's actually a transform. So even though being her batchmates, knowing her for so long, it's a shame that I didn't even know that you're actually a transformed left-hander, and I thought both of us are actually facing the same issue, and
Same
we
here.
will like support each other, talk about it today. But unfortunately, no, we actually are quite different, which is also fine because that's where they can get both point of view. Yeah.
Is it too late to change now?
For Ezian, you mean?
Yeah,
I don't
for
know.
Ethan.
Yeah, definitely for me because I'm the pseudo one, right?
Yeah.
So I guess if I really want to change, I don't know. I mean, I can try, but I'm just so lazy. I guess I'm so comfortable with what I'm doing, and yeah, I don't like doing fillings. I don't like doing any other stuff which so I just pass on to my colleagues. So yeah.
Yeah. All
But
right.
no,
So
don't get me wrong.
sorry.
Any left-handers outside, if you want to transform, it's never too late.
Yes, it's never too late. Yeah. So the next question is probably meant for Dr. Doris. As the years goes by, do you feel you have gained more confidence in using your right hand?
Yes, definitely. Yep.
Especially in
Sometimes,
especially doing things which requires a lot of precision, is it?
yes.
Or about Dr.
As,
Ethan?
So you're
Dr. Isin?
you're fully using your right hand for even a crown prep, fillings.
yeah, as long
You can
as
actually control your movement that precise.
I need to use a handpiece, I use my right hand. Yeah, even for crown preps lah.
Do you cheat and use your left hand to do some motions? No.
For handpiece, no, because it's I feel it's a bit a hassle to pull it the
Wow,
other
very
side.
keng.
Yeah. So I only use sometimes I use my left hand
Yeah,
for
so
some hand. Yeah.
so do you even use left hand at all? Like when do you even use your left hand?
Like for handpiece, I don't use my left hand. I only use my left hand for like sometimes I need to use couplant or luxator or forceps on the second or the
Oh,
third
that's
quadrant. Yeah. Then for
so we're
that
quite
purpose,
opposite then. You're left-handed, I'm left-handed.
yeah.
But I use right hand for couplant and luxator, but you use left hand for couplant and luxator. We're like the opposite.
Sometimes lah, I mainly I still use my right hand for the hand instruments like couplant luxator. But sometimes like if I would need to work on the left side, then I use my left hand because it's easier that way. Yeah.
Yeah. So yeah, the position where you stand.
Yeah.
So for me, yes, but the only thing that I can gain confidence more is my right hand. But because I also have the benefit of my left hand, so during extraction, I actually do both. So if I do my right, I get tired, still there, then I use my left hand, loosen a bit. But I go to the other side, because like I said, now I have more space. My practice, I do have more space on the left, so I can then go to the left and do it. Still cannot because it's really weird using left hand doing extraction. So I'll just do the bit of relaxation, make it loose. The final bit is still always my right side to do the real exodoncia, really. Even though it's already loose, somehow psychologically I still go back to my right to just get that final twist to get it. I can't do it it's just so weird. So the only thing is that. Yeah.
Okay, thank you, Doctor, for sharing that.
Yeah.
Before that, I'd like to encourage all the viewers, if you have any questions, please feel free to just put down your questions at the comment box below, okay? So the guest speakers are highly qualified to be answering all those questions for you, okay? So moving on to our next question. Okay, this one, okay.
Sorry, Nolan. Also for the viewers, if you guys are left-handed, then maybe you can also share what we have not shared in the comment section, maybe, so that Nolan or Bashri can actually read it out, because it's just coming from the two of us. And also, if you are a left-hander, just notify, so at least we can high five, say hi. Sorry, Nolan, can continue.
It's okay. So moving on. Okay, so majority of the dental instruments and equipment we know that are made for right-handed. So did this kind of like affect your efficacy, maybe your effectiveness, and also your confidence level? Okay, maybe in dental school first, then we can talk about in KKM.
Not really for me, actually, because yeah, to me, when I use any instrument, for example, like the spoon activator or like what Bertrand has asked me just now regarding the hand scaler, I didn't think so much when I was a student. Or you use this, you're supposed to angulate it, put on the root surface and plan. So okay, that's it. Or this is a spoon excavator, go in, remove carrier's lesion, go in, scoop, scoop, scoop. So it didn't really occur to me that it actually gives me an issue. So like even like luxator, coupler, and criers or whatever that is supposedly this is for left, this is for right. I still use it based on what it's indicated for. So I don't invert it. Yeah. And yourself, Doris, any problem? What about you?
It's like somehow during dental school, everything is a struggle for me. Yeah, so but the equipment is okay. The equipment is okay. It's just maybe just me. That's what I was thinking at that time. Yeah, so yeah, but eventually, practice makes perfect. Yeah.
Okay. Thank you, Doctor. So, okay, I think we have some of the viewers' comment. So, I think I'll just show it here. Okay, it's question by Dr. Lahari herself. She says that what are the advantages of being left-handed in dentistry?
Hi, Dr.
Listen.
Larry. Well, yeah, because I think this is for me because you are using right-handed anyways. So I think if you ask me like that, so I believe based on my experience like I said just now when I'm extracting, sometimes something very difficult I use my right hand to do and I get tired because I take too long. So then I can cheat by using my left hand. I get the benefit because my left hand is my dominant hand, so I can use that to kind of do loosening up, help me to loosening up a bit more. Then I go back again to my right hand. So I think that I don't know if you call it an advantage, but that is something for me that I do. And sometimes like even scaling, I do on my left, and when I'm doing so I start off left with my right quadrant, and as I go to the left quadrant, sometimes my left hand find it a bit difficult. I just switch it over, use my right hand to do the second quadrant buckle. But yeah, so it's not very good because whenever I go back again, I do see things that I miss. So then I will then switch myself to the left and there. So I wouldn't see a huge advantage being a left-handed, but yeah, I think it's good in terms for me during extraction. I can actually switch around, play around. I don't know if you right-handers have this benefit of switching around during a difficult extraction. I hope that answered your question, Dr. Larry.
Right.
Hello?
Yes.
Yeah, so there is one comment from Ashton Chan. He just graduated. So he says, I do switch in between my hands for hand scaling. I felt it is an advantage to switch in between. I do use my left hand for distal side of teeth in fourth quadrant and right hand for mesial of the same. Because it's hard for me to engage the calculus using only one hand, another add point is I am able to avoid fatigue, especially while doing the hand scaling. I was advised to be careful while switching so that I don't drop my instruments. That was a
Nice, Ashton.
very
Are
good.
you a pseudo? Are you a pseudo or so you are considered pseudo as well? Then means you use majority left, but you will switch to your right hand to do certain areas. Yeah, but for me, no. I cannot control my hand scaler with my right hand. For me, I will move myself or I move my patient's head to actually suit my my angle, because right hand is for that fine movement, because when you're doing hand scaling around the gum areas, you need it to be very precise and good, because you are working so close to the gum sulcus, you don't want to tear or like lacerate anything down there. So yeah, for me, I move myself, or I turn my position here. So I don't know if this will help you, Ashton. Um, uh, to see, so that you use still your dominant hand, unless you're like Doris where you're transformed, then it's different. So you use the still your dominant hand, but move your patient's head to your advantage, or move yourself to your advantage, so that you can actually do a proper clean. I think that's my take of it. So I hope that helps.
All right. So this will continue. So did you wish to have a left-handed supervisor to guide you along the undergraduate journey?
Well, of course, yes, that would
So yeah,
be
like I said,
that.
if only Dr. Ali told me.
Dr. Ali wasn't left-handed, as far as I know.
Correct.
Yeah.
Yeah. I don't think any of our lecturers are left-handed. So that's why they actually didn't really comment it. So, but yeah, I think whoever in final year, or rather the ones that have been into clinics, I think it's important, because if, let's say, the senior did not tell me about using right hand, I would have been a purely, or rather, I think one of your classification, basically, was genuine left-handed. So there's 3: genuine, pseudo, and also transform. So if I will be a genuine left-handed, I think it's going to be quite difficult for me, especially doing extraction. Yeah. So I'm already finding it difficult doing, you know, restoration, which is a bread and butter for a dentist. You do see caries teeth very frequently. So yeah, I think it's good if someone actually kind of guide us. And I think the best person to guide us is actually a left-hander themselves, that transform, maybe like Doris, or a studio like myself, that can guide our juniors. So I think it'll be nice if we have that.
Okay, we move on to the next question. The next question is, okay, do you think that there is a need for alteration to the learning environment and also increasing its access to like one-to-one teaching approaches? What's your thought on this or opinion on this?
Maybe I would like to know, like, how is your learning process nowadays? Is it like more towards traditional lectures and tutorials? How is it for you guys now?
Also, we also get to go and ask our mentors.
Okay, so it's like more. Do you still have the? Then what was that thing called already, where we used to
PBL.
have a group?
PBL, yeah,
Yeah,
home-based learning.
PBL.
Yeah, we still do have that.
Yeah. Basically, I think PBL is a good effort. Yeah. And if there's more interaction between the lecturer and the students during lectures and tutorials, that would be nice. Instead of the traditional where the lecturer would just talk and they do their thing, and the students would just be maybe sleeping behind. Yeah.
But I think this
So
question is related to left-handed, right? Like you are talking
Yes,
about is you're asking us if there's any alteration that needs to be done
yes.
for
okay.
that. So yeah, sorry.
Okay. So
So
probably.
I think they're asking more in relation to left-handers.
Okay, I see. Okay. Right. So I think probably left-handers. Uh, I'm not sure how many left-handers are there now in your batch for your juniors.
Yeah.
Yeah,
Yeah.
so probably there's more compared to our time. So last time, because there wasn't so many of us left-handers, so probably it wasn't uh we didn't think that it could be a problem. And or maybe left-handers just feel that, oh, maybe we should just suffer in silence. Yeah. So since now I think probably there's more and more left-handers now. So it may be good to have some session where where there's more concern for the left-handed students. Yeah, there's more reaching out to them and say, oh, okay, don't worry, you're not, yeah, it's it's not a problem if you are left-handed. If you face any more of a support for left-handers, I think that would be nice.
Actually, on that note, Nolan, your batchmates, how many left-handers?
From my batch, there are currently 3.
3. And yourself,
Yeah.
Peshri?
I think probably 2 or 3 also.
So yeah, even my batch, I think just the 2 of us, if I'm not mistaken. So yeah, generally I think each batch will have 2 to 3. So to me, answering that questions, I don't know if we left-handers are being a bit selfish, is to maybe have a left-handed chair. So at least we get to try whether it is suitable for us, because I've never seen, or I don't know if there's anyone having a left-handed chair, because number one, they are more expensive. Number two, there's only 2 people in the whole batch that's going to use it. Is it worth spending money to have a left-handed chair just for that 2 people? When so many of the seniors have already graduated being a left-handed and still do fine in a right-handed chair. So, but I think if you ask me, maybe, I don't know if it's too much to have a left-handed chair. But then again, having a left-handed chair, not having a left-handed lecturer, then it also defeats the purpose. So I think to answer this question, yes, I think the alteration should be not much of the changing your instruments or whatever, but more on having more left-handed approach. Then maybe a lecturer, they can find a niche, a lecturer who is left-handed to be able to teach as well. So I guess that is something that maybe can help us left-hander. So for example, if someone, I keep bringing this up, if Dr. Ali told me to use left-hand, maybe I would have been a transformed left-hander.
Yeah. Was there any left-handed doctors in PIDC?
Back then, yeah.
I don't think so.
Not,
I don't think so. Yeah, I don't think so. Either they transform, or no, I don't think there was any left-handed during our time in PIDC. Is there any now? Because I think a lot of lecturers has changed. Is there any lecturers?
Not that I know of.
It'd be nice, to have a left-handed lecturers. But left-handed lecturers doing restorative.
We should ask Dr. Lahari. She has
fun.
any left-handed colleagues?
Okay. So guys, we'll
maybe
look
Dr.
at.
Ali was a left-handed.
Sorry.
Never know. I don't know that one.
Yeah. Sorry. Yes. Continue.
Sorry. Okay. Yeah. Okay, guys, we'll look at some of the comments. One of them. Okay. This is by Zixing Lim. Dr. Doris and Dr. Yisian, do you ever have any self-doubt along the dental school due to left-handed dominant? If you did, how do you go through it?
Zen, you want to answer first?
No, never have. No. To me, I don't have any self-doubt being a left-handed. Like I said, it's like me asking you to do. I mean, no, I really didn't have any issues being a left-handed throughout my entire career, starting from being a student. Like even my batchmates, when we work together, I don't think they even say, "Oh, why you use your left hand to do filling one?" So weird. Nobody actually made that comment. So to me, I didn't even think that was an issue to begin with. So we just help each other. We just do, or as long as we get to do that class 2 filling, show it to our lecturer says good, we're all happy, So yeah, to me, no. I'm not sure about you, Doris, but I didn't have any doubt at all. Maybe I'm also a bit chill, don't care kind of people. So
you
didn't
know
really
me, I'm
bother
quite
me
chill also. Yeah. So self-doubt maybe a bit lah when you started to practice using my right hand.
Because of left-handed? Okay.
Yeah.
Okay.
Yeah. Yeah. At first lah, during the practicing period when you're not used to it, And then especially when your lecturer is behind you, say, hey, faster, faster, why you so slow, you know?
Oh,
Yeah, so it was quite stressful
looking
that
at you, right?
time lah. Yeah, that time lah. Then but don't, if you have this kind of thought, you know, don't
So how
just
how do you go through it? How do you go through it?
well, I just bear with it. So I was thinking, okay, I can do this,
Ignore
you
the
know,
lecturer.
don't, yeah, I just ignore the lecturer. Okay, eventually I'm going to get this done. Okay, it's like better to do it properly than to, you know, just yeah. So yeah, you will get through it.
Okay, thank you, doctor.
Yeah, so there's one comment here. Not left-handed related. What can you say to those who thinks they have shaky hands, especially when they're doing something for the first time? When they're nervous, what to do to lessen it and to boost their confidence?
Your shaky hands,
Okay.
what's the reason for your shaky hands? Like, is it because of you're nervous or because you're not, is you're
I think
doing
so
it for the
because
first time, you've never done
I
it
think so.
before?
They did mention doing it for the first time and they're nervous. So
Yeah.
I actually
So
have that experience. I don't know about you, Doris, but I
Starkit
actually
is
had the
a second year
experience.
student. Yeah,
Okay.
Starkit is a
Okay.
second year
Wow.
student. So she just started her preclinicals for conservative. So I believe she's mentioning about holding the handpiece.
Oh, okay. Well, I would say don't worry too much, because it's normal. Because it's your first time using a
We
handpiece,
have
and
been
because
through
the
it.
handpiece, yeah, the handpiece has itself has some weight on it, so it'll be a bit if you're holding it for a long time, it might be a bit tiring for you. But after keep doing it, and your muscles will get used to it. Yeah, and if you really feel like, you know, okay, there's a muscle cramp coming on, you know, just relax, let go, rest for a while. Then when it's okay, continue again. Eventually, your muscles will get used to it. Yeah.
Yeah,
Okay.
as one of the technician in Masa told us before, Mr. Roslan, he said you can use a stress ball and exercise your grip. Yeah, because he
Yep.
noticed that during my year there was a lot of people feeling discomfort with holding the handpiece, but he said just exercise your grip with a stress ball and you can grip the handpiece better.
So actually, I would like to add on. I don't know about you all, but I do have shaky hands initially when I'm giving injections. So when I retract, when I want to give my injection, and you know how, we need to be precise on, especially the area. We don't have to be very precise, but you want to hit at the right spot. So when you are shaking, you won't be able to reach that target so well. My advice, or rather, someone advised me. I think it was Dr. James during my OS time, is to actually tuck your elbow as close as to you as possible. So because when you're leaving your shoulders up, you don't have a support. That's where you will shake. But if you have a support, if you have an area that you tuck yourself in, so where I can't show you, so put yourself, tuck it near your body, and you kind of retract and do the LA. You can actually do it better. So I'm not sure. I don't know what your Starcade is actually facing. If it's a handpiece, then I think what they have suggested is good. But if you're talking about giving LA or suture, just always tuck yourself. Use your elbow, put it as close as to your body, use it as that support, and then do your job. Because for me, when I shake, it's also because when you have lecture looking. So I remember my final exam, OS. I'm not sure if you remember, Doris. There was this suturing station. The lecturer there
Ah.
have to see. It's an OSCE station, I think, where they will see how you do your suture and stuff. So talk the thing where everything was shaking. So just calm yourself down, tuck yourself in, and then you'll be better. As long as you have a support, it's just like when we do any treatment, you need to have a rest, you need to have a finger rest. The reason being is you want to be precise. So to me now, I'm using the same concept, but to use my body as a rest, so that I can actually do it. So try it out. I don't know if that helps you, Starkate. But if you're talking about fillings or the hand pieces, then yes, I think whatever that was suggested is probably something that you can try. But if you're talking about giving an LA, doing suture, and you're shaking, tuck it to you. That's my advice.
Okay, thank you, Dr. Doris and Dr. Yisian. Okay, we shall move in with the next one by Shalini Jayasegaran. Hi, doctors. Have any of your patients complained of discomfort due to using left hand? Thank you.
So I think it's to me again because Doris uses right hand. No, actually, I don't know if my patient even realized that a left-hander is actually treating her or him. But yeah, I've never had an experience of my patient coming up the chair saying, "Hey, I remember the last time the other doctor, did the clean was much better. But you are doing it a bit, more painful." So I didn't have that comment so far. Touch wood. Hopefully, no comments in ahead. But I don't think patient actually realizes, as long as what we do is based on the principle of whatever the technique is still the same, meaning to say you don't burr, when you drill, you don't burr the gum, you don't burr the cheek, you don't burr the tongue. Left-handed, right-handed, if you do any of this, it's discomfort anyways. Patient will complain anyways. When you scale, when you just, accidentally poke them, they will complain anyways. I don't think that is left-handed or right-handed point of view. It's a mistake that both, I think, regardless you're left-handed, right-handed, that you will do sometimes, that you just have to apologize and continue on. So I haven't had any complaint actually, because I'm a left-hander. Complaint got plenty, but not because I'm a left-hander.
Okay. What about you, Dr. Doris? Like, have based on experience, are there like any patients who have like came in like any behavior changes? Like they suddenly, oh, why using left hand? Because I'm more used to, the patient's more used to having treatments done on the right hand. So like, have you experienced that?
So far, I didn't really have a problem with this because most of the time, as Isian say, the patient doesn't realize that you are right hand or left hand. They will only complain of when you do make any hurt them or something like that. Yeah. So yeah, basically, I work on my right hand, and then on my right hand side only certain sometimes when I have to work on certain areas, I go to my left side or I use my left hand, and try to be careful not to hurt the patient or cause any pain or discomfort. Yeah, so that's very important.
On a note, actually, when a left-handed patient comes to me, then we have something to talk about. Then we're like, "Hey, you're left-handed. Yeah, oh, you're left-handed too." So that was, that's something. Right-handed patients won't say that to a right-handed dentist. So I think that is then you get a bit of a chemistry or some rapport going on with you and your patient. That, oh, you're left-handed, I'm left-handed too. Then we can kickstart there. So I think maybe that is also an advantage, Dr. Lari. The second advantage, I would say, you kind of get that relationship because we have something in common. Yeah.
Okay, thank you, doctor. Okay, moving forward, Basri.
So, did you face any discrimination for being a left-handed dentist in your personal life and university education?
No.
I wouldn't
I think
say there's any
we've
discrimination.
talked about this quite a fair bit.
All right.
Okay. What about like
lecturers don't say, hey, this 3-7 I give left-hander, 4-6 I give a right-hander. No, they don't do that. So I think we don't get this discrimination a lot. Either way, it's a case for you, regardless it's a left side too, right side too. Just have to do it. You have to do it. Yeah. So no, I don't think we face any discrimination in that sense.
Okay. Okay, doctor. Another question is the market out there left-hander friendly?
Yisian, you want to answer this?
I would say so because everything that is outside, I still can perform. I still can do what I can do, and I don't. The problem with this question is that I don't know how is it like being a right-handed. I have nothing to compare. It's not like I have something to compare. Like for example, being in a under the hot sun or being inside the aircon room for sure better. So then I can compare. But with being a left-handed throughout my life, I've not tried doing it with my right hand. To me seems to be quite okay. I don't find any issues. I don't find any problem until today. Maybe because we are talking about it, and suddenly, maybe is that why I'm not doing a proper filling properly? Maybe is that why because I don't get a proper angle on my handpiece, and then I cannot do properly. But prior to this, no, I've not felt any of this issue actually. Yeah, Doris, do you feel it?
Probably not so dental related lah. Other things probably sometimes it's not so
like what
left-hander
actually?
user friendly. Like when you're writing during school, like I said, because the book,
Okay.
the
Yeah, you
binder
get.
is on the left side. Yeah, so if you write with your left hand,
Oh, okay.
yeah, that's a problem lah.
Those
Okay.
the lecture hall table with the right-handed table on it.
Yeah, that's another thing.
Oh,
Yes.
okay. Yeah. Oh my gosh. Now that's why I say I don't feel it. But now that you mentioned it, yes, it's always I have no hand support when you are writing. Yeah. Actually, yeah, true. I didn't think about that.
For
Yeah.
Dr. Yisen, do you think you will invest in a left-hander dental chair in the future?
I don't think so. Reason being, like I mentioned earlier, I feel weird working on the left side. I feel like I'm in a new territory. It's not something that I'm comfortable with because all this while I've been working on the other side. So whenever I'm on my left, it's a very brief time. I don't spend very long. Majority of my time is still always on the right. So investing in the left, I don't know whether it will be a benefit or it will actually cause more trouble that I have to learn, have to relearn, have to rethink the position and everything. But what I say, so maybe So I don't think I will invest in a left-handed chair for now. But if it's hurting me so much and a left-hander somewhere, maybe some audience say left-handed chair is very good for left-handers, then maybe it's worth trying. Because I don't know anyone who actually used a left-handed chair before.
Unless you open a dental clinic, then you recruit all the left-handers lah. Then you can get one.
And then only have left-handed chair.
Okay, next we'll look in.
Good one.
We'll look into another comment. Okay, better option to transform? ? By Andre Yap. Better option to transform.
Well, I guess from my point of view, it definitely has made my life easier. Yeah, so but it's up to you whether you're comfortable with it, whether you feel like you want to do it. Yeah.
Right.
What about you, Dr. Yisin? Any thoughts on this?
Yeah, I mean, if you ask me what would I advise, my juniors who is a left-hander suddenly come to me and say, "Oh, I'm a left-hander. Would you have any advice?" I would actually say back what as I mentioned. It's probably better option to transform, because everything it's on the right-hander side. Yeah, but you ask me why, I cannot answer you. That's the problem because, like I said, I've not experienced doing it that side. So. But definitely right-hander in a right-handed position, you will be you definitely get a better hand. So yeah, I agree with this statement. I don't know if it's a statement or question. I don't know if Andre is asking. Okay, maybe he's asking. So yes, I think it's better option to transform actually.
All right. Another question. What is advice for new student left-handed planning to study dentistry?
Go ahead, do it. I don't think there is any discrimination. I don't think you should be worried. Try it out. I think as left-hander, you do have some advantage of trying right. And if you still can't, you can still use your left hand to do it. Don't worry. Like both of our experience actually, I'm considered more genuine, a bit pseudo left-handed, where Doris is transformed left-handed, and both of us are doing all right. We are still able to treat patients. We are still to do whatever we want to do. So I don't think you should stop yourself or change course. Don't do dentistry because you are a left-hander. So that's the advice for me. But you can look into the option of starting young, using right hand, holding hand pieces, do a lot of preclinicals, doing a preclinical time, do it more, get the grip, get the hang of it, and then you like you see Doris and a few others. I'm pretty sure they have transformed themselves to be a right-handed. So don't stop yourself because you're left-handed. Don't let that stop you.
Okay,
I think Doris would have
moving
agreed.
on. Hello.
Yep, totally.
Yeah, Dr. Doris.
Yeah, she agrees. Yeah, moving on.
Sorry, you
Nolan,
didn't hear
saying?
me, is it? Okay.
Yeah, I think he didn't hear you.
Oh, okay.
So we'll move to the final question from our side. So, do you have any tips for your fellow left-handed colleagues?
So, okay, I think this is again for me. So sorry, Doris, I'm taking a lot of your time. But
No problem,
as a
no problem.
left-hander, I think what tips. So if you're using that type of chair, what I'm trying to change now is instead of crossing my arm, I actually use my right hand to pull, and then I pass it to my left hand to do. So I don't cross over. So that like I said, it's very rude to pass through patient's face, to go over, even though they don't complain, but it's just manner point of view. So I'm trying to do that, pull it. If you're using the type where it's stuck onto it, what I'll do is I'll hold it over, and then I use my pinky finger to hold it so that it doesn't drop onto my patient's body. I kind of hold it up so that it's taller than on their body. A handpiece point of view, that's how I do it to not let it land on my patient's body. Because sometimes you pull it over, then the wire will be on the face. That's really too bad. Not nice at all. Another thing I can suggest is, the table that we have. If you're doing a filling, for example, you need a lot of changing in instruments. You need your tweezer, you need your plastic, you need this, you need that. You need to keep on overextend your hand to get it, and you can't always just use your right hand to take and pass. Your whole thing will just be delayed. What I can suggest is to have a trolley right at your left hand, so it will be between patient's head, the trolley, and then your nurse and you at the right side. So you can actually do that. So for me, extraction, I do that. For me, filling, I'm trying to see if I can also get that. I just want a table near me so that all my stuff is there. So I don't have to overstretch to always reach out to that trolley. And if you see, habit, every time I want to overstretch, I'll use this to support so I can pull. So yeah, maybe you can support yourself again. Yeah, so that came out habit. But yeah, I think these are the few things that I'm doing now to help me to make my flow a little bit better. And your assistants have to be trained. So changing assistants can be quite difficult because once they are used to you, they can go anywhere to work, no problem. Because for them to assist a right-handed, no issue. But for a next nurse coming in to assist me, is the whole process that I have to go through again to kind of guide them. So I will put my hand there, I was stationary, I put it there and say, look, I have to be here. There's no other way I can put my hand because this is where I can reach. But you got here to enter your suction. So try to find a way to go in. So over a period of time, it's like dancing. When I come here, then my nurse will come out, go in. Then when I'm done, when I come out, she will go in. So that's why I think for left-handers, you need to have that one or two nurse that they know you, that they can. I don't know how is it like for right-handers. Do you have such issue of fighting with your nurse? They're blocking you or whatever. But for me, I often get that. They always block me, and then I'll just tap their hand, and they will just have to remove and go the other way or find any other ways that they can go. Because I will always try to leave an area for them to go in. So you have to help them, they have to help you, both sides. So yeah, I guess that would be the tip for now for for any other left-handers who are like me, pseudo or genuine left-handed.
Thank you, Dr. Isian. What about you, Dr. Doris?
Okay, since I'm a transform left-hander,
Yeah.
right? Yeah, so
Or transform.
I can no lah. I still say the same. It's like if you still feel that okay, you're confident using your left hand for most of the procedures that is in, then go ahead. It's good for you. But let's say if you think that you want to try to transform, uh, that's very good also. But you will need to be prepared that it's going to struggle in the beginning. Yeah, but don't give up, and you will get there eventually. Yeah.
Okay, thank you, Dr. Doris and Dr. Eason. Those were like really very useful tips for all the left-handers out there. And us being, me and Bashir being right-handers,
Hopefully.
it's like very nice, interesting for us to listen to your experience and everything that you've shared so far. So thank you for joining us today. Thank you very much. Okay, everyone, please do follow our
Thank you for
Instagram page
listening.
at PIDC Virtual Circle. So thank you, doctors, for joining us today.
Right. Thanks for having
Thank
us.
you.
Okay, bye.
Thank you. Thank you for listening, us complaining.
All right.
Complete.